off. Hi, everyone. Good afternoon, and welcome to today's special Fireside Chat in recognition of National Cancer Survivors Month. According to the National Cancer Institute, there are an estimated 18.1 million cancer survivors in the United States, making up about 5.4% of the population. This number is expected to rise significantly and may even reach about 26 million by 2040. As we anticipate this growth, the importance of research in cancer survivorship becomes even more critical. Continued advancements in research will be essential to improving the quality of life and care for the increasing numbers of survivors in this country. In today's Fireside Chat, we have a unique opportunity to learn more about the critical research being conducted in the field of cancer survivorship at the University of Minnesota. Our goal is to provide valuable insights into the challenges and advancements in this important area and to celebrate the resilience and strength of cancer survivors. The Fireside Chats are brought to you by the Office of Community Outreach and Engagement at the Masonic Cancer Center at the University of Minnesota. The Office of Community Outreach and Engagement serves as a bridge between the Cancer Center and communities across the state of Minnesota and beyond. Our dedicated team is committed to reducing the burden of cancer by actively engaging communities and providing access to relevant knowledge on the latest in cancer research, prevention strategies, the importance of screening and early detection, treatment options, survivorship, and opportunities for clinical research. My name is Amna Hussein. I'm the Community Outreach and Engagement Manager on our team, and I will be today's moderator. On behalf of our entire team, I would like to thank everyone for being here today. We are so honored to have Dr. Tara Rick, a renowned expert in cancer survivorship research, with us today. Dr. Tara Rick is a research associate in cancer survivorship at the University of Minnesota. She is a member of the Screening, Prevention, Etiology, and Cancer Survivorship Program within the Masonic Cancer Center and a member of the Scientific Network on Female Sexual Health and Cancer. She is a long-term physician assistant in hematology and oncology at mHealth Fairview with a special focus on the effect of cancer and its treatment on the sexual health of cancer survivors. Dr. Rick received a PhD in radiotherapy at Erasmus University in the Netherlands. She also sits on the board of the Foundation for Cancer Care in Tanzania, teaches at the University of Minnesota and St. Catherine's University. And she also contributes to Cure magazine. She is so busy, as you can tell, and we are just so delighted to have such an accomplished expert with us today to share her insights and experiences in the field of cancer survivorship. We will be recording today's Fireside Chat, so you can refer back to the recording and share the recording with folks who you think might be interested, and the recording will be posted on the Masonic Cancer Center's YouTube page. For University of Minnesota employees and spouses participating in the university's Employee Wellbeing Program, you can earn wellbeing points for attending today's Fireside Chat by completing the form that will be linked in the chat shortly. And before we begin, just a few housekeeping items. We'd like our audience to get familiar with using the Q&A feature, which is going to be located on the center bottom of your Zoom window. During today's presentation, please use the Q&A feature to submit any comments that you might have, some of your reactions and questions. We have time carved out at the end for some Q&A with Dr. Rick. Okay, without further ado, I will now pass things over to Dr. Rick. Dr. Tara Rick, the virtual floor is all yours.
Thank you, Amna, for that really generous introduction. Let me just get my slides up here.
It's actually on the right view now.
Okay, perfect. Thank you. So I want to thank all of you for being here today and joining us for this Fireside Chat. You know, I want this to be, you know, I really want to take the idea of this, that this is a fireside chat, and really think about, you know, if we were all sitting here together with our coffee mugs and having a conversation, that I'd also want to know why you're all here. So we have a couple poll questions about, you know, who is in our audience today, and that can help me sort of tailor my talk. So Amna, if you could load those questions. So which of the best following describes you? Are you a cancer survivor, a caregiver, a healthcare professional, public health professional, or another reason, or somebody else?
And we'll give it a couple more seconds. Looks like we're almost at all participants. Okay, ended the poll.
It didn't pop up.
Let's see here.
Here we go. Good. So we have a lot of cancer survivors here. So welcome, and welcome to the caregivers, the healthcare professionals, and the public health professionals. And of course, I'm curious about, you know, the other group. So feel free to write into the chat if you want to tell us why you're here. And actually, for all of you, you know, if you could just write in, you know, what you're hoping to learn, why you're here. We would love to learn a little bit more, and we'll just take a few minutes for this.
I just launched the second question, so you can type in what brought you here today. I think we'll give you about another 30 seconds, and then I'll close it. All right, I'm going to end this poll now.
All right, and maybe after we talk about the objectives, Amna, if you don't mind just maybe summarizing kind of why people are here. All right, so what I want to talk to you about today is really, you know, who exactly are cancer survivors, and what challenges do they face? And I want to visit the history of cancer survivorship, because I feel like it's important to understand where we've been, to understand where we are now. And then I really want to highlight what are cancer survivorship clinical services, what are educational opportunities that are offered. And I recognize that not everybody on this call lives in the Twin Cities. It's possible that people are from other states, or doctor in other healthcare systems, and that's okay. I think that we'll keep this information as broad as possible. And then I want to, the focus of my talk is actually not centered specifically around cancer survivorship research, but we will talk at the end about my specific research interest, as well as some of the research activities that have been going on at the university in the past and that are ongoing, that are really pivotal in cancer survivorship research. All right, and Amna, who do we have here? Who do we have here today?
We have folks that just want to learn more about research opportunities, wanting to learn more about their survivorship program. We have some caregivers wanting to understand how they can best support their loved ones. And then folks just curious, folks interested in just learning about the next phase of the cancer journey. But yeah, a lot of kudos to you too, just wanting to hear more from you. But yeah, that's who we have, and folks just wanting to learn what's next in terms of cancer survivorship research.
Great, thank you. And just a few quick questions, and these questions are just for our cancer survivors. And I also want you guys to know that these poll questions are, you probably already figured this out, but they are anonymous. So the first question is, I want to know what type of cancer did you have or do you have? And we don't have an other button, I see. So I apologize to you, those of you who aren't represented here.
Feel free to write anonymously or submit an anonymous cancer type if you're not listed on here under the Q&A feature. That's an option as well for folks that their cancer is not represented in this poll. And again, we apologize for that. I'm going to end this poll now.
Okay, good, thank you. And then one last question. I would like to know about how it kind of goes into what we're going to talk about now, but I want to know where you feel like you are in your cancer journey. Are you currently being treated for cancer? Are you free of cancer, or are you living with cancer? I kind of broke it into just very simple categories there. And I understand that it can be more complicated than that. So if you're living with cancer and you're being treated for cancer, please choose living with cancer. Okay, we have a mix of everybody, so that's great. So thank you all for being here, whether or not you're a cancer survivor, caregiver, healthcare provider, community member. I'm so happy that you're all here. And where I want to start out is just setting the stage with a definition of what the NCI, the National Cancer Institute, defines, how they define cancer survivorship. And cancer survivorship is from the time of cancer diagnosis and through the balance of life. So it's a very inclusive definition. So this captures, all the types of populations that we just polled. So whether or not somebody is being treated for their cancer, sort of in the surveillance phase, sort of long out from their cancer, or somebody who's living with metastatic disease. So I'm very happy that you are all here representing our population. And now the word survivor doesn't always resonate with everybody, and we understand that. But why we think it's important to use this term is that it helps us identify a population to be able to study the population to be able to learn more about how we can provide better care and reduce barriers. And then it's also those of you who are caregivers on this call, you are also considered cancer survivors. You're considered secondary survivors. Obviously, you feel very much the impact of cancer and cancer treatment as well, and are a very important component. So in regards to resonating with the term survivor, a recent National Coalition for Cancer Survivorship study survey actually found that 85% of people do consider themselves a cancer survivor, wherever they are in the cancer continuum. And as Amna said, there are 18 million cancer survivors currently living in the US. So cancer survivorship is important because this is a large population that is only projected to grow. And why are we only going to get more cancer survivors is because cancer mortality is going down, but cancer incidence is going up. And the downward trend in cancer mortality is our big wins related to things like smoking cessation, earlier cancer detection, so people participate in cancer screening, and then treatment advances. Our treatments have gotten better over time. But cancer incidence, however, is on the rise for many of our common cancers. And the trend is largely affected by the fact that we're a growing and aging population. But also there is an increase in incidence rates in some of our common cancers like breast, prostate, endometrial, pancreatic, kidney, and melanoma. So a few other statistics sort of setting the stage is that 67% of our cancer survivors are 65 years of age or older. And why I highlight that here is because this is an underserved population in regards to research. A lot of research focus in the past has been around childhood cancer survivors and the young adult, the adolescent and young adult population, which is obviously a very important group as well. But as we're thinking about who are our cancer survivors, a majority are 65 or older. For our adolescent and young adult cancer survivors, it's about 600,000, as well as our survivors who are living with metastatic disease, which maybe you've heard the term metavivor, which can be a term for this group as well. Now, and then I just want to have a slide about race and ethnicity, and you can see, and this is also broken down by gender in a binary. So you can see that the highest cancer populations are in our white, Black, American Indian, Alaska Natives, and then lowest in our Asian American populations. In regards to specific cancers, our cancer survivorship population is made up, the three biggest groups are breast cancer, prostate cancer, and colorectal cancer, which makes sense when you think about cancer incidence in the US and the common cancers. Although we don't see, lung cancer is a very common cancer, but there's a high mortality rate with lung cancer. So it isn't a common survivor population, but that's changing. Now, cancer survivorship is important because there is a cost to cure or a cost to cancer treatment. And I'm not just talking financial. We know that there's a cost to quality of life. There was a study in 2004 that showed that cancer survivors were twice as likely to self-report their health status as fair to poor than the general population. We know that there is a cost to functional limitations or functional status. So when I'm talking about functional status, I'm talking about physical, psychosocial, as well as cognitive. A lot of you probably relate to the term that we call chemo brain and kind of the cognitive changes that are after that people can experience with and after cancer treatment. And some of these functional limitations have more than doubled over the past 20 years. And this is really surprising because our therapy has gotten more targeted. But the specific populations that tend to have the highest functional limitations are patients, survivors who have experienced pancreatic and lung cancers, and then lowest for prostate and breast cancers. So then we know from the data that we can really focus in on some of these higher need patient populations. Cost of cure also is the risk of late effects. So we know from the Childhood Cancer Survivorship Study, which we'll talk about more later, that 3 out of 4 cancer survivors will have some sort of late effect or chronic health condition in response to their cancer treatment. And then 1 out of 4 will have a severe life-threatening late effect. And the figure really shows that late effects, so the blue line is mortality related to cancer, and the risk of recurrence is the highest, in the first, usually 5 years after treatment, and then plateaus off. But then you see the gold line are external causes, but non-external causes, meaning they're related to the cancer and the cancer treatment, but they're not specifically related to the cancer. So this could be secondary cancer, secondary malignancies. This could be cardiovascular disease, caused by cancer treatments. We think of the treatments that are the highest risk are chemotherapy drugs that are called alkylators, because they can increase the risk for having a different type of cancer, and it kind of increases the risk for all cancers a little bit. And then when you have radiation to a certain body site, wherever the radiation field was targeted, there can be an increased risk of cancer or other effects. So now shifting gears to thinking about the history of cancer survivorship a little bit. This helps us understand where we've been and where we're going. And just to set the stage a little bit, we've come such a long way in oncology over the past 100 years. If any of you have read the book Emperor of All Maladies, you understand this history and how far we've come. But just to give a little perspective, so in the 1960s, you had a 1 in 4 chance in surviving your cancer, 5 years. And at that time, kind of a major pivotal change that really changed the trajectory of cancer treatment and care was that the US Surgeon General in 1964 issued a report stating that cigarette smoking was a hazard, and that the United States needed to go into action to reduce its harmful effects. And then in the 1980s, there was about a 50% chance of surviving 5 years from cancer. And an important development that happened at that time was when tamoxifen hit the market. And tamoxifen is a medication for estrogen receptor positive breast cancer that can reduce the risk of recurrence by up to 50%. So some serious, significant risk reduction happened at that time. And then since then, there's been so many advances in oncology treatment, prevention, screening. And we'll circle back to what our 5-year survival rates in general are in a little bit. But I think that this is a really profound, in 1985 was a really profound moment for cancer survivorship. There was a perspective piece that was published in the New England Journal of Medicine called Seasons of Survival, written by Dr. Mullins, who was a physician who was a cancer survivor. He was diagnosed when he was a young physician with a non-Hodgkin's lymphoma. And he wrote this editorial piece, and I just want to highlight a couple things. So he says, "It did not occur to me that while I was acutely ill or for some time afterwards, that the simple concept of sickness and cure were insufficient to describe what was happening to me. I was, in fact, surviving, but struggling physically and mentally with the cancer, the therapy, and the large-scale disruption in my life. Survival, however, was not just one condition, but many. So he goes on to talk about that there are 3 phases or seasons, excuse me, of survival. And he talks about that there's this acute phase, which is when somebody has been diagnosed with cancer until the end of their treatment. And the hallmarks of this phase are, fear and anxiety, what just happened, kind of going into crisis mode, and then dealing with acute symptoms of cancer treatment like nausea, vomiting, diarrhea, mouth sores, neuropathy, all those types of things. And then he was the first to also recognize that that caregivers are the secondary patient as well, and very important. And then he identifies the second phase as he calls it the extended survival phase. And this is a period from the end of treatment until 5 years out from cancer, because for most cancers, that's the time period where there's the highest risk of recurrence. And this is a phase of surveillance. This is a phase, where you feel like you're looking over your shoulder. There's the fear of recurrence, and that there are physical limitations. After all those acute side effects have gone away, oftentimes there's fatigue, there's neuropathy, there's the chemo brain. There's all the things that are really challenging because you want to get back to your life as what it was before, and sometimes there are a lot of challenges to overcome, and sometimes people don't go back to their baseline, and I know we say things like new normal, which I know does not resonate very well with people. And then the third phase is sort of this 5+ years out phase. And as you saw in that graph before, the risk of cancer recurrence is lower, but the risk then starts growing of potential late effects depending on what kind of treatment that you had. And also I want to highlight here that, this is sort of before cancer survivorship was defined by the NCI to be really inclusive. And patients who are living with cancer or have metastatic disease or advanced cancers, non-curable cancers, kind of end up cycling, through these different phases, kind of again and again as well. And now I just want to know where are cancer survivors who are on, our chat? What phase do you feel like you identify that you're in at this time? And as we're doing that, I'm just going to move on, if I can, to the next slide too. Because I think that this graphic here, this is just a graphic way to sort of look at those 3 phases and kind of highlight what we're talking about here. Okay. Okay. So thank you for answering that. And then just one more. No, I think that's it actually. So thank you. That helps me understand who we're talking to. So thank you so much. And then another thing from Dr. Mullen's editorial piece was that he said, it's as if we have invented sophisticated techniques to save people from drowning, but once they've been pulled from the water, we leave them on the dock to cough and splutter on their own in the belief that we've done all that we can. So that just really, as somebody who's taken care of people with cancer for a long time, this really resonates with me and how I see that people feel, particularly after the end of treatment, when you're going from seeing your oncologist from, very frequently to then these extended visits. But in 1986, so because of this work, the term cancer survivor was used for the first time. And I think that this really highlights what are our goals in cancer survivorship. We really want to attend to, kind of with this analogy here, we want to dry you off. We want to attend to your physical psychological and spiritual aspects of this traumatic event that happened to you. And we want to reduce the risk that it happens again. And that can be by talking about what types of things that we can do in regards to screening or health promotion to reduce that risk, and how to best live well after cancer or with cancer, and then whatever that means for each individual and their situation. So admittedly, nothing much happened for the next 10 years until 2005, when this paper was published. It was titled "From Cancer Patient to Cancer Survivor, Lost in Transition." And it was a landmark report that really talked about that there was this gap. Patients were being discharged from oncology at 5 years. They were not necessarily following with a primary care provider, or if they were, the primary care provider wasn't clear about what unique needs that the cancer survivor had, and there was really this gap. And patients weren't getting as good of care because of it. So this was really a need. And then since then, a lot has happened. And the NCI, for all the NCI, National Cancer Institute designated cancer centers in the US, usually the bigger academic cancer centers, the NCI mandates that the programs have to have cancer survivorship programs, which is really great because it really helps push programs forward. So now there are more resources for patients in this across the board. And now in 2024, about 70% of cancer survivors are living 5+ years. So this is, again, why this is so important. We have a lot of cancer survivors, and we have a lot to work to do and to support their needs. Now I just want to talk to you about clinical services, like what is survivorship, what is cancer survivorship care, and what can it look like? And I just want to give the caveat that there are specific core components of cancer survivorship, kind of some of those goals that I kind of talked about when we were talking about the analogy with the water. But every cancer center can really have their survivorship services as they want them to fit the needs of their patients. So here at the university, our cancer survivorship services are housed within oncology. And we have 3 distinct programs. We have adult oncology, Dr. Ann Blaze and myself. We have BMT, and then we have our pediatric team. And this is not exclusive. Cancer survivorship is also happening at the level of the oncologist and the PA, nurse practitioner, nurse of the disease teams as well. And it is an automatic referral into the program for our pediatric and our BMT colleagues. But for adult oncology, again, a big population of patients, typically what we would like to see happening is that every patient has an end of treatment visit with their oncology nurse practitioner or PA to sort of set the stage of kind of here's what you had, here are the unique things we need to think about with you, and here's our plan moving forward. And then where I come in is I see patients who are 5+ years out from their cancer and thinking about if they haven't had end of treatment visit, we have to sort of go back and do all of those things. But then we think about what are the unique risks of late effects moving forward, and then how can we help patients live better quality of life. And this is not necessarily like longitudinal care. So when I see a patient, it's at least a one-time consultative visit where I summarize everything into a cancer treatment summary and care plan. But I think of people, we risk stratify. So I think about what is your risk? Do you have low risk? Do you have moderate risk or high risk? And patients with low risk they've had surgery, but maybe not had any chemotherapy or radiation. And when I say low risk, I'm talking about of late effects. And then with moderate risk, this is where most people fall in, have had some sort of chemotherapy or radiation. And then the high risk patients are patients who have had higher doses of chemotherapy and radiation. And typically I see the low risk patients once. The moderate risk patients, I give them the option of following if they want to, although it's perfectly appropriate for me to summarize everything, and then that care can be done through primary care. It's again bridging that gap between the patient, the oncology department, and then primary care. And then patients who are high risk, I follow annually. What do we do at a cancer survivorship visit? If you've ever seen me in clinic, I've probably told you that there are three parts to my clinic visit. The first part is, where have you been? We summarize your cancer and your cancer treatments, and sometimes this can be complicated because I see patients who are not just treated at the U. Sometimes people have been treated a long time in the past, and we have to gather records or outside institutions, that type of thing. So we gather your records, we summarize your cancer and your cancer treatments, and we kind of put everything all together. And then the second part is, I want to know how you're doing now. And I screen for late effects. I screen for for quality of life. We're not only thinking about you as a physical being, but we think of sort of you as a whole person. So we think about physical, psychosocial, and sort of spiritual needs. And then the third part of the visit is, where do we go from here? And that's where we together create an individualized care plan. We talk about resources. I make referrals if there are ways that there are certain kind of lingering side effects or things that we can do that I think that we can do to improve. We talk about research opportunities if there are any that are applicable. And then we talk a lot about health promotion. What are some things that you can do in regards to diet, exercise, reducing alcohol, stopping smoking, that can modify your cancer risk? And it's really all about empowering the cancer survivor to take an active active role in their care. And then we have a lot of resources to connect our patients with. And this is not just pertinent just long to that third phase. These supportive care services are pertinent in all three phases and for all cancer survivors. So just want to shift and talk a little bit about cancer survivor education and what opportunities that we have available. And I just want to highlight that these opportunities are available to you whether or not you doctor in the University of Minnesota system or you're even in the US. We partner with community partners, leverage philanthropy. These resources are free to you to use. One thing that we do every spring is a survivorship conference. And I'm just going to speed ahead a little bit. I want to have time for questions. And then we have a survivorship webinar class series every fall. And these are topics that patients tell us that they want to hear about. We get a local expert to answer their questions. And then we put the recordings all online. So I have a lot of, when I see somebody and they have questions about nutrition, we'll talk about it, but I'll say, do you want to meet with a nutritionist, or we also have all these resources on our website if you want to get some additional information. We also hold a survivorship picnic in the summer, and it's actually coming up on June 21st. If you're interested, there's more information on our website. And then new this year, which is really exciting, was Caregiver Con. This was just recently on June 1st. And this is a conference specifically for our secondary survivors. And this is in collaboration with two of our local cancer survivorship caregiver NGOs, the Negative Space and Jack's Coalition. And then lastly, I just want to cover a little bit about specific, we've kind of speckled in, research about cancer survivorship throughout, but I just want to highlight some of the research activity, things that I'm interested in my research interest specifically, as well as, what types of other projects have gone on or are going on now. So, just a little background. So sexual health is one of my clinical and research interests. And I've been taking care of cancer survivors for 18 years, longitudinally. So, I felt like I was asking a lot of questions. But then when I started kind of narrowing my focus to cancer survivorship, I realized how important it was to think about all aspects of overall health and well-being, and sexual health is an important component of that. So once I started just asking everybody about their sexual health, I was shocked to find out that everybody had something to tell me. And before I asked, we rarely talked about it. So I realized, I felt so much shame that I had missed so many opportunities with patients over the years that I knew must have been having significant symptoms, but for whatever reason didn't bring it up. But these are some of the things that, I hear from patients very, very commonly. I hear that it's painful to have sex. I used to enjoy sex, but now I have no desire to be intimate with my partner. And there's various reasons for that. It could be related to medications that we're on. It could be related to antidepressants. It could be related to shifts in relationships with your partner, stresses of cancer, depression, anxiety, that type of thing. I didn't realize how much the loss of my nipples would affect my sexual functioning. So this is one that I now hear very commonly. And where the nipples are innervated into the brain is the center where orgasms occur. So for a lot of people, they don't even realize it, but they're really important for their sexual functioning. I feel self-conscious. So a lot of these, since a lot of my patients are breast cancer survivors, a lot of these are, some of these are specific to them, but I feel self-conscious about my chest and I can't get out of my head when I take my shirt off. My partner was supportive through treatment, but now thinks I should go back to normal and I don't feel normal. Body image, of course, is a common thing to have to kind of think about and work through. And then I also hear a lot, my partner is afraid to hurt me. So there are a lot of different ways. So sexual health isn't just one thing. There are a lot of different facets to it that, and a lot of different areas that can be affected by cancer treatment. So intimacy, like what is going on with the dynamic of the relationship, body image, how do I feel about myself? Desire is libido. Arousal is the body's physiologic response to get ready for sexual activity. And then how do I feel about everything? Am I satisfied? And sexual health is fundamental to overall health. And it's not just about intercourse or not. There's many different ways to have sex and be intimate. So I think this is important. I really wanted to highlight this here because we know that this is an unmet need and it's not being talked about enough. We know from the literature that many cancer survivors are experiencing sexual health side effects, but they are not bringing it up. But the research also tells us that they want us as healthcare providers to bring it up. And we know that healthcare providers aren't bringing it up. So it's an unmet need. And some of the barriers to healthcare providers asking about it could be just not thinking about it. But usually it's that if you haven't really been trained in what to do about sexual health side effects, you don't usually bring it up and ask about it. So the good news is a great majority of medical providers have an interest in acquiring additional training. So one project that I'm currently working on right now is we trained breast cancer staff. So care coordinators, nurse practitioners, and PAs to screen for sexual health and talked about what to do about it. And then we are going to study if this intervention actually does change our screening rates. And then another thing that we're working on is I'm working with a group of colleagues to develop a new medication to improve vaginal dryness. This is in early stages of development, but I think it's really exciting because really the mainstay of treatment for vaginal dryness is topical estrogens, which are considered to be safe and effective even with patients with estrogen receptor positive breast cancers. However, patients and healthcare providers are really hesitant to use them. So then in consequence, women are suffering from side effects that they don't have to. So this is an area that we're working on. And just briefly, I just want to highlight some of the work that's come out of our group. That some of it is completed, some of it's ongoing. For example, the CCSS is the Childhood Cancer Survivorship Study, and this was a big study of a lot of childhood pediatric cancer survivors, and then their siblings as controls, and they were followed over a long period of time. And this data is actually what all of our pediatric and AYA cancer survivorship guidelines are based on, because it really helped us understand what their unique needs were, what their risks were, and how can we mitigate those risks. This research has now moved over to St. Jude's as the researcher moved to St. Jude's, but really proud of that research legacy with the university. Ongoing research is looking at frailty in BMT survivors. Also, we're looking at biomarkers for accelerated aging. We know that cancer survivors feel like they're aging faster than their peers. And we know that this is true, and we're trying to figure out if there are biomarkers or things that we can measure to show this, and then that there can be interventions that we can look at to see if we can slow or reduce that. And then for the sake of time, I'm just going to move on here because I think it's important. We do have a current research opportunity that I want you to be aware of. So for the cancer survivors in the group, if you are in that AYA adolescent and young adult category, so kind of from 18 to 39, and you were diagnosed with cancer in the last 5 years, and you live in the metro and you're interested in participating in research that's more nature-based wellness research, this would be an opportunity for you. So there's a QR code there, or else there's an email address there on the bottom of the screen. And if you miss it and you want it, just email us and we can get that to you. All right, so take home message is that cancer survivorship care is part of the cancer continuum, and we really want to close the communication gap between you, oncology, and primary care, and then to empower you to be an active participant in your own care. We want to focus on the survivor as a whole person. So we want to think of all the different components of well-being. And then we want to also have a different prong approach at this, providing clinical services, educational opportunities, as well as research to advance the field. So that is what I have for you today. So happy to take any questions.
Thank you so much, Dr. Rick, for that insightful and wonderful presentation. It was really inspiring to hear about the progress that's being made and the ongoing efforts to support cancer survivors. So now we'd like to open the floor to questions. If you have any questions that you would like Dr. Rick to answer, please submit them using the Q&A feature, and we will do our very best to address as many questions as possible in the about 9 minutes that we have remaining. So get your questions in. Quite a few questions have already come through. And before we dive into the questions, as always, it's not a fireside chat without getting our fire going. So I'm just gonna get our fire started. All right. And I also will say that we won't be able to answer any questions that are seeking medical advice. So please make sure that you're talking to your healthcare providers about those questions. Actually, before we get started, I want to just mention that our Cancer Survivorship Program that Dr. Rick highlighted some of the upcoming events. There is also an upcoming caregiver con that's happening November 2nd. So that will be happening, and we will include the link to our survivorship program website where you can see all the events that Dr. Rick mentioned in the follow-up email that will be sent tomorrow. And then also we'll make sure to include Dr. Rick's slides and some of the other resources that she mentioned. There are some folks asking for Dr. Mullen's article.
Mm-hmm.
Okay, so quick question here. It looks like a few folks are asking, so what is BMT? So like, what is a BMT survivor? Can you specify that?
Oh, I'm sorry. So bone marrow transplant.
Okay, thank you. Let's see here. So what do you recommend? Sorry, so many questions. What do you recommend patients to do if English is not their first language and they want to build community?
So build a cancer survivorship community. That
With
is
English,
a great, pardon?
with English not being their first language.
Yeah. So that is a great question. I think what I would do in that scenario is, I would want to know what type of cancer has this individual had, and then I would circle in. I would contact their social worker as part of their oncology clinic and ask to help find some resources in your specific, not only in your specific cancer type, but also there might be resources also within your language, depending on, I don't know if we're talking about Spanish or Arabic types of groups or other. But I think social work is a great place to start to help like figure out a starting point to look for resources and community.
So this question is specific to, so what role do you believe technology and the digital health tools will play in the future of cancer survivorship care and research? It's kind of a loaded one.
Okay, yeah, so that's a good question. So I think that there's great promise. But with any great, great promise, there's great responsibility. And I think digital health tools are already being used for patients for education and things like patient reporting of symptoms. This is also called PROs, patient-related outcomes. However, we as healthcare providers really need to know how best to use these interventions and implementations. Implementation science specifically is a type of research that can be used to help us understand this. So, for example, our group developed an interactive app to educate Hodgkin lymphoma survivors on their risk of cardiovascular disease and breast cancer and what kind of specific screenings that they needed that were different than the general population. And this digital app did increase knowledge, but it didn't necessarily increase uptake in these screenings. And we don't exactly know why. The type of research that we didn't have that qualitative component to really get in a deep dive into like understanding what are the barriers. So I think we need to have, we need to use digital health and technology where applicable, but we need to be just very mindful about how we use it.
So there's a question that was just submitted. Which chemos age patients the fastest?
So, I don't know if we know it to that granular detail. I see that Dr. Sadak is on the call, so if he wants to jump in on that. But I do know that typically we think about the alkylating agents. That's like a class of chemotherapy, and a common drug within that class is cyclophosphamide. But I think what is happening is I think it's more of a class effect with chemotherapy as a whole because of the DNA damage that occurs. That's the purpose of chemotherapy, to cause DNA damage to the cancer cells, but then there also gets that sort of peripheral effect on healthy tissues as well.
Dr. Sadak, you can talk. Sorry to put you on the spot if you wanted to add anything.
No. Can you hear me okay?
Yes.
Oh, great. Thanks, Tara, for the chance to chime in here. The thing that really comes to mind with that question about what accelerates aging the most, um, at least in childhood cancer survivors, is this treatment with radiation. So not getting at that question specifically about which chemotherapy drug, but certainly with radiation therapy treatments, and sometimes those that are directed at things like our brains or central nervous system, those type organs, really are starting to look like they have some real strong connections with this issue of increased frailty or increased and accelerated aging. But there's a lot of thought too about potentially, at least the thought of the more intense the treatment, whether chemotherapy or bone marrow transplant or radiation, um, possibly the higher risk for this accelerated aging. So, like you said, a lot still to be studied and teased out, but definitely something that's real. It's not in our head. It's not something you're just being told, hearing about, thinking about, or you can, suck it up and get through. This is real. And the next step is figuring out how we're going to stop this or reverse it. Thanks. Great job, Tara and Alma. Thank you.
Awesome.
Thank
you,
you.
Dr. Sadak. So we have time for just like 2 more questions. This question is asking about how can survivors stay informed about new research and advancements in cancer care that might be relevant to them?
Yeah, that's a great question as well. I think one way is getting connected with the Cancer Survivorship Program. These programs often will have educational events. For example, our conference or the Thrive series, where you'll get local experts talking about a specific topic. So if anything, is cutting edge or sort of new in that area, you'll be hearing about it there. And it's really easy to get on, our mailing list if that's something that you're interested in, or, if you're in another state, look into your nearest cancer center and Cancer Survivorship Program. And then another resource that's a little bit more complicated for the layperson to use, but you can always go to clinical trials, clinicaltrials.gov. And then you can search survivorship or your type of cancer specifically, and then your zip code, and you can see what active trials are available maybe in your region and what you could potentially be eligible for. But it is more geared for healthcare providers. So it's there's going to be some things might be a little bit more complicated there in regards to medical language.
Thank you. And last question. So how can community-based organizations and healthcare providers better collaborate to support cancer survivors, specifically those from underserved populations?
Yeah, also a great question. I think that there are so many opportunities. I love to attend patient conferences, such as like the Breast Cancer Education Association. If you guys haven't heard about that association, check it out, because they always have booths, as well as our resources as well. But they always have booths with local community partners, and these are great resources that I can learn about to tell patients about. And they often will be, there will be sort of meeting the needs of like very specific cancer survivorship. Cancer survivor groups. So then there's a way that then I can help spread the word and connect to patients to these types of resources. This, I think, do we have like on our website any list of like our community, kind of the community partners that we collaborate with? Because that might be something to take a peek at.
Yes, we do. So on the Survivorship Program website that you have a link to, there is a resources tab, so you can see some of the local nonprofit organizations. And there's one that I'll put in a plug for, the African American Breast Cancer Alliance. That's a really good organization specific to breast cancer patients, but specifically Black women and men diagnosed with breast cancer. So yeah, you can check out some of the local nonprofits that we work with, but I think attending any of our survivorship programs, you can get exposed to some of those organizations. They are often there collaborating with us. They are also some of our exhibitors too. And we're at time now, so I know we could keep you a lot longer, Dr. Rick, so we'll just conclude here, but thank you so much everyone for all of the thoughtful questions. We apologize we could not get through all of them. There were quite a lot, but thank you so much for your engagement and for participating in today's Fireside Chat. We hope you found this discussion and the presentation informative, and thank you again, Dr. Rick, for joining us today. So after the session ends, Zoom will auto-populate a window to complete a brief survey for us. We would greatly appreciate your feedback on today's Fireside Chat, and your input is invaluable and helps us continuously improve our programs. And after submitting submitting the survey from today's Fireside Chat, don't close the window, because there is a link to enter the drawing for a chance to win a prize pack filled with goodies from the Masonic Cancer Center. And the survey, as well as all of the resources that were shared today, will be in the post-event follow-up email that will be sent out tomorrow. And we would invite you to join us for our next Fireside Chat on August 13th at 1 p.m. for a conversation on translational research from bench to bedside. We're taking a break in July, but we hope to see you on August 13th. And lastly, make sure you follow the Masonic Cancer Center on all of our social media platforms to stay up to date on future announcements, events from the Office of Community Outreach and Engagement, and also our Cancer Survivorship Program events as well. And thanks again, everyone, for joining, and we look forward to your continued engagement. Have a wonderful rest of your day and week.
Thank you so much, everybody.